All right, so you're enjoying time with your mom? Perfect. All right, well listen, give your mom a big hug for me, okay? Yes, and I'll see you. Okay. Hey, listen, I've got to go, all right? I love you. Tell your mom hello for me. Okay, bye-bye.
I'm Dr. Carroll.
Hi, Dr.
Nice
Carroll.
to meet
Jeff
you.
Disney, nice to meet you.
Nice to meet you. So, this is your...
Excuse me, I'm sorry.
No problem at all. No problem
My
at
kids
all.
are off visiting their mom, so...
No problem. So this is your first visit to the clinic. The nursing note, the nurse wrote that you wanted to talk about some privacy issues or some private matters.
Yeah. I'm 52, and I work out at the gym, and a buddy of mine was telling me that he recently started the androgel, and he was kind of feeling a little down, didn't feel like he was getting good pumps out of his workouts anymore,
Right.
and sexually wasn't kind of feeling good things either, and so got a little bit of the androgel, and things went much better for him.
Yeah.
So I just was hoping maybe I could get some to give it a try and see what it's like.
Well, I mean, are you feeling like a lack of energy or, decreased desire?
Well, no, desire is not the problem. I wish, things were a little bit better. I mean, I'm 52, but I think mainly it's just a little bit more energy, a little bit more pump, kind of like when I was back in the 20s and 30s.
Yeah. Well, androgel it's a product for men that are feeling, actually probably having symptoms or feeling signs of decreased testosterone levels.
Yeah.
They also often communicate decreased sexual desires, more difficulties with sex.
Yeah, I think the desire's there. I wish I lasted a little bit longer, but, 52, man.
The other thing, too, that you always want to consider, and something I think about with my patients is, consideration if you've talked about these potency issues or potency questions with your wife. Many of my patients, in fact, have this conversation with their wives before they come in.
Yeah, I haven't really had a chance to talk to my wife about it, but yeah, potency is kind of a concern I've got too. Yeah.
Okay. Well, so let me tell you. So androgel, it comes in a gel form or a patch form.
I think he's got the gel that he rubs on.
Exactly, and you really have to be thoughtful and consider the fact that you really want to try and keep this away or avoid contact with androgel with women of childbearing age or children. It's been shown to cause early puberty, and so what I would suggest to you is, if we do prescribe androgel, that you make sure that you keep this away from children at home. Are you going to be able to do this at home?
Yeah, it's not going to be a problem.
Good. Well, I'll tell you what, let me step out. I'd like to do an exam right now, but I'll step out. Why don't you go ahead and put a gown on, and when you're ready, just knock on the door and I'll come back in.
Okay, all right, yeah, thank you. Hey, so listen, have a great time, okay? Make sure, yes. Yeah, exactly. Okay. Hey, listen, I've got to go, all right? Give a hug to your mom, and I'll see you in a couple of days, okay? All right, bye-bye. Hi, excuse me, I'm sorry. My daughter's off visiting.
No problem at all.
Nice to meet you, Jeff Disney.
Nice to meet you. So, this is your first visit to the clinic.
Yeah.
And I was reading the chart. The nurse made a note that you wanted to discuss some private matters.
Yeah, Dr. Carroll, I am 52 years old. I like to work out, I like to keep active, and one of my buddies at the gym, Bob, was telling me that he recently started using the androgel and felt that he was getting a little bit more energy from it, felt a little bit more pump in the gym, and kind of helped him out sexually too. And I was hoping maybe I could get a prescription for it, but I don't know the side effects and stuff of it, so I wanted to kind of talk about that.
What do you know about androgel?
He told me that it's basically you kind of put it on an area that's hidden underneath your body, so smooth skin and stuff. And I think he uses it once a day, and he's kind of felt pretty good with it. He felt like it gave him a little bit more energy. The game was a little bit better, and sexually it kind of helped too. He felt like the potency was a little bit more, lasted a little bit longer, and yeah, I'd like to think about that.
Well, sex is healthful at any age.
Yeah.
And there's also some ground rules I'd like to lay down with you, just so you understand.
Okay.
Our group has several policies in place, and probably one of the most important ones is confidentiality. Okay. That you feel comfortable knowing that whatever we discuss in this room will not leave this room.
That's good to know. Thank you.
Absolutely. It sounds like you're very comfortable talking about sex issues and health concerns surrounding this.
Yeah, I am.
Are you okay if we continue on this line of discussion?
Sure, yeah, thank
Excellent.
you.
Absolutely. So I just want you to understand that we make no assumptions as it relates to your sexual identity, who your sexual partners are, or any of your sexual activities.
That's good to know, thanks, I appreciate that.
And that, I promise you that we like to use the term partners, just again, not making any assumptions
Okay.
in terms of orientation.
Okay, perfect.
Very good. And with those ground rules, let's move forward. Let's talk some more about androgel.
Okay, yeah, so I've heard that you use it once a day. And